Hello, everyone. My name is Hannah McGahey, and I am the Workforce Coordinator for the Kansas Children's Cabinet and Trust Fund. And I am joined today by Megan Broha, and she's going to be monitoring the chat for me, putting links in from our presenters and from our slides. And then also, if you have any technical issues or questions, you can field those to her as we run through. So really excited today. As usual, we're just going to provide kind of an overview of what's happening in the system, specifically professional development opportunities. We've got a lot of really great conferences coming up and opportunities for you all to connect that we will highlight. And then we've got a presentation from the Kansas Breastfeeding Coalition, and we're also going to learn a little bit more about their conference. So for those of you who don't know, the Kansas Breastfeeding Coalition, represented by Brenda Bandy, has been a wonderful partner over, the last few years. But we've hosted them a couple of times here on the webinar. I just really like to make sure that we're bringing them back periodically because they're always such a great supporter of professional development and just collaborative opportunities professionally. She's also on our panel this year, the Early Childhood Recommendations panel. So just some great representation across the system. All right, so for those of you who are program participants in the state's quality recognition system, which is a QRIS. We call ours Links to Quality. So if you're a program participant, then you're eligible to participate in a free 3-part workshop series specific on budgeting and some financial tools and knowledge for running a business as a childcare provider. So they're hosting these workshops on September 27th and also October 11th. But it's just walking you through creating a budget and then just, all of those financial decisions that go into maintaining a budget and running a business and being sustainable. So there's limited spots available for this opportunity. And if you're interested, I believe that we have a link to connect you. But again, this is only for programs that are already participating in Links to Quality. So great way to just learn and grow as a business. And then we also have a free opportunity from KDHE. You can have your water tested if you're interested through the Kansas Department of Health and Environment, and you can check for lead. And again, this is free, so it's a great opportunity. If you have questions, you can call this 800 number. You can also sign up online to make this happen. And then if you'd like to learn more about some of the hazards of having lead in your drinking water, you can check out the link that'll be dropped in the chat. And it's from the EPA, from the Environmental Protection Agency, but very relevant, especially if you're, operating out of maybe an older building or an older home, very relevant. Family Jam Fest is happening in Andover, I believe. I have too many screens up. Yes, Andover. So this is going to be hosted by Child Start, and it sounds like a really great weekend opportunity for families. I don't know about you guys, but we're always looking for what's happening locally, whether that's going to a splash pad or checking out like a cider fest. So this is an upcoming event that you can bring your family to. There's going to be clowns, which I don't feel like I need to say much more, but clowns, there's musical acts, there's food trucks, just a great kind of small town, full of activities type of opportunity for you and your family. There is cost, but also a really great way to connect about the importance of quality early childhood care and education, specific to some of the services that Child Start provides. So if you're interested, just check the chat. But again, this is Andover, and it's going to be October 8th. It looks like they've got a lot of really cool stuff lined up. We also have a parent cafe series, and this is a quality sub-grant. I know you all are familiar with those. So this is funded by the Preschool Development Grant, which is one of the ways that we are working on a lot of those objectives within the All In for Kansas Kids strategic plan. And so one of the recipients of a quality subgrant has put together an opportunity for parents to collaborate and learn together. And so you can register for this Cafe series. We've got a link, and then you can also learn more about the actual the model and the system and listen to recordings of previous parent cafes in the same link. So I would definitely check that out. All of it is going to be in the vein of integrated behavioral technologies. And this is the third series of parent cafe presentations. So I've heard that the previous were very successful and very meaningful for participants. Okay, very important. This is probably one of the more important things that I'm going to be telling you about today in our general updates. And so many of you may have heard some whispers over the past few months about ratios potentially changing and some of the parameters around age groups changing. And so if you are interested, if you have feedback about this, I need you to go to the link that's provided. The Kansas Department of Health and Environment is really wanting to hear your voices about a potential regulation change. I've got the regulation listed here, the actual number, but specifically this is the regulation that talks about ratios based on age. And so I went and looked at this the other day just to see if I could kind of decipher it, because I'm not incredibly familiar with the existing ratios and how that all fits together depending on what age groups or ages of children you have. But they've got it broken down and they have some helpful tables to help you understand what the changes are going to look like. But they also have a link there on that webpage to provide some written feedback. Okay, so if this is something that you have some concerns about, or if you think it's going to be wonderful and could expand your business or help you kind of maybe mitigate some barriers that you were dealing with those ratios, regardless, please advocate for yourself, advocate for your business, follow the link, and provide that written feedback by 5 p.m. Friday. And I'm sorry, I'm moving a screen. That's October 28th. We need all of this written feedback submitted to KDHE. So if you're a child care provider, if you are connected to the early childhood care and education workforce, I would encourage you to go read this regulation and provide your subject matter expertise, right? Because you all are the ones that are doing this every day and have a lot of experiential knowledge to share. All right, so we keep updating you on the workforce appreciation bonuses. So for those of you who don't know, the Child Care Workforce Appreciation Bonus has been just a complete labor of love, a partnership between DCF, so the Kansas Department for Children and Families, Child Care Aware of Kansas, and then the Kansas Department for Health and Environment. So a lot of work, a lot of effort has gone into figuring out how to systematically allocate these one-time bonuses. So if you know somebody that works at those agencies and was involved in this, just give them a thank you, because I know it was around the clock and it's been an endeavor. So these are payments of anywhere from $750 to $2,500, just depending on eligibility requirements. But these are going to reach over 20,000 eligible childcare providers. So that's pretty incredible. This is a direct payment to providers. We're currently in school age and drop-in program. So that's the eligibility period that we're in right now. And one thing I'm going to highlight, we had a presentation from the interim family health director, Drew Duncan at the early childhood recommendations panel. And he said that two important things have changed. So there were a couple of issues with direct deposit. And so now those bonuses are going to be mailed out. And then the other thing is, please, 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 if you haven't yet, please verify your information with, let's see, this would be, I believe, Work Life Systems with WLS through Child Care Aware. So there's, and maybe somebody can hop off and tell me where this information needs to be verified before I speak out of turn. But if your information has not been verified or updated recently, then that's going to become a barrier for you getting your bonus. So take care of that first, please, and then be ready for when your window opens if you have not, if you've not been given your bonus yet. Another thing that we heard at the panel was that there's a little bit of a waiting period between being eligible, submitting all of your information, and then actually receiving your bonus. I think we were hearing like 4 or 5 weeks. So definitely make sure that you're using your resources and connecting to the technical assistance that's provided by Child Care Aware if you have questions, but there is a little bit of a wait. So I think patience is appreciated. Like I said, there's a lot of people that are working on making this happen. And we'll continue to update you on which eligibility period we're in and which, from center to family child care, who's eligible in what time frame. We talked about this a couple of months ago, but I really do want to highlight this again because I think it's very important. So many of you may know that Medicaid and CHIP enrollment, there were changes made during the pandemic to allow for emergency coverage. And so that is going to be ending. And we want people to be prepared so that your health coverage is not just dropped off without any warning. So there's some webinars that are being offered by ACF and HHS, the 28th of September, October 26th, and then December 7th. So if you know somebody that is currently benefiting from the CHIP continuous enrollment or an extra Medicaid coverage that's because of the pandemic, just please be aware that those things are going to be unwinding, and encourage them to listen to these webinars so that they can start preparing for another way to get coverage. And Megan will be dropping that in the chat. All right, so these conferences that I've been talking about. So we have KSAEYC that is coming up in Manhattan next month, October 7th and 8th. I went to the KSAEYC conference website and checked that out. They've got some really cool information about what you're going to be learning, who you're going to be listening to. Just a great way to connect to your peers. So if you're interested in that, the registration link is also on their website. And then we have the Kansas Breastfeeding Coalition annual conference and meeting, which we're going to learn a lot more about from Brenda here in a minute. But that's October 13th and 14th in Wichita. We also have a virtual Mom and Baby Action Network National Summit, and that's October, and it's in Atlanta, but also virtual. So you don't have to miss out if you can't make it to Atlanta, but that's a great excuse to go to Georgia. And then the Parent Leadership Conference, which we've hosted KCSL here recently to talk about that, but just sounds like such a wonderful opportunity. That's going to be in Topeka. It's at the old, it's the name of the new hotel is slipping my mind now, but it's the old Capitol Plaza Hotel there by the Expo Center. And so there is some scholarship opportunity available for families that are traveling from outside the Topeka area. But just a really great engagement opportunity. And Pam Noble was gracious enough to come on and kind of give us a little taster of the leadership conference, and said that there's activities designed for all ages. So a lot of engagement for little kids. I think they're working on some new ideas for that adolescent, maybe preteen group. But just a really great opportunity for families to come together and relax, learn, and collaborate. So again, there is money set aside for actually paying for those stays at the hotel. If you're traveling from outside Topeka, I think there might be a range. And then the event itself is free. So if you have questions, you can email Pam Noble, and she can provide a little bit more information to you. All right, and so with that, I'm going to go ahead and invite Brenda to come off mute and give us an update.
Thank you. Thank you so much, Hannah. It's always an honor and a pleasure to be with this group. And I would like to introduce one of my other key partners, Chris Nicholson, who will also be speaking up as well. And I see Linda Logan is there from Casito, another one of our partners from way back, like 2013. So it's great to see our partners here and so many people on the call. So we will go ahead and dive right in. And Chris is going to speak in the middle of that. Linda, you might be called upon to give a little bit of information if you'd like about the Casito training. So next slide, please. Thanks. So for those of you who may not be familiar with how does breastfeeding in the early childhood world intersect, we just wanted to take you back to what is it the KBC does to get you oriented. Hopefully many of you are familiar with us, but we recognize that there are many of you that may be new to this field, and we just wanted to get started there. And then Chris is going to take us through the how to get involved in this work of the intersection of breastfeeding and the early child care setting. And then we're going to round this out on education opportunities. So Hannah, thank you so much for teeing up that conference. I am excited that that is just one of many opportunities for childcare providers and programs to get involved in. So that's how, this is the map of where we're headed. Next slide. So what is it that the Kansas Breastfeeding, what do we do? What is the Kansas Breastfeeding Coalition? Next slide. This is our mission, is really to normalize breastfeeding throughout Kansas. So while we don't provide direct services and helping moms and babies to, latch on and actually breastfeed, we try to improve the world in which they live so that that is possible, that they can breastfeed for as long as they would like to. And so we know there are so many systems that intersect that. So we really are working more with the systems like the early childhood systems to improve the settings in which families breastfeed. So that's the work that we do. And in the next slide, you'll see all the details. Are you ready? This is a lot. This is a lot. We had to add that last little rectangle just last week because we continue to expand our work. So here we go. We have a designation called Community Supporting Breastfeeding designation. This is where a community, a city, a county can receive a designation for supporting breastfeeding across 6 different systems in their community. So it's a community level designation we've had since 2014. If you'd like to know more information about any of this, and I'm not going to go into detail because we have so much more to talk about, but do know that all of this is on our website. We have breastfeeding education courses, which we will talk about later. We support local breastfeeding coalitions, which we hope all of you are connected with. We have a new designation to what I like to call our suite of breastfeeding friendly designations. And this new one is the local health department designation that just launched in February. And of course, our beloved early childhood provider education program, which we partner with Casito, and the breastfeeding friendly designation run by Child Care Aware of Kansas. We also have a continuity of care to support breastfeeding. This is recognizing how do we help families transition from the hospital back out into the community to continue breastfeeding. We have window decals, which hopefully you have seen. If not, if you don't have these in your community, please reach out and you can have programs enroll in this. We encourage every child care program to do that. And I think Chris is going to talk about that in a minute, but it's a window decal that says breastfeeding is welcome here. It's that simple. We also have prenatal classes specifically for parents. We have a COVID vaccine awareness program that just launched earlier this year. We work with employers through the business case for breastfeeding. We train lactation support providers through our clinical lactation training program. Our first 1,000 days program is an advocacy program that we work on. And then we do have new maternal child benefit specialists that help families to enroll or renew their Medicaid coverage. So I was really excited to see the slide that you had about the Medicaid is going to be ending. And so how do we help families renew? And so we have 2 specialists that were actually just trained earlier this week in Wichita, and they will be in Southwest Kansas and in Northeast Kansas. I'll get the information to you so you can put it in the notes. And they are going to be not only helping you with the paperwork, but they're also going to ensure that they're able to find breastfeeding friendly childcare and to work with their employers and make sure that they have a breast pump and are enrolled in WIC. So we have a little bit longer checklist. It's a little more of a customized enrollment process for Medicaid to go through all of that. Next slide. So that's a lot. We're really busy, and we are growing not only in terms of our programs, but also in our staff. But one thing that we do every year is a state of breastfeeding report. It comes out on August 1st of every year when the CDC releases the new breastfeeding data. So we are ready to go and we have this report template ready. So in the next slide, I'll share with you what was released in August of this year. This is the latest information that we have. And Kansas is in the dark blue bars there. The great news is, I love to celebrate the good news, we are doing better than the rest of the country. Yay! And that's because of all the work that everybody does, right? It's not just one program in Kansas. It's not just the hospitals doing great work. It's not just the health departments or WIC. It's the childcare programs. It's all of y'all. So thank you for the work that you're doing. And we've got work ahead of us. While we're doing a great job with nearly 90% of families choosing to breastfeed, let me just say that again, nearly 90% of families in Kansas want to breastfeed. They're not able to sustain that. You look at the graph bars go down over time, 3 months, 6 months, with only about a third of families reaching 6 months exclusively breastfeeding. And what do we mean by exclusive? It means they're not getting anything other than breast milk. And that's the recommendation, even in the new AAP guidelines that just came out this summer, that infants receive nothing other than breast milk for approximately the first 6 months of life. But in Kansas, you can see only a third of that 90% are able to continue with that. And when we reach a year of age, only 40% are receiving any breast milk. So we think 60% of infants are celebrating their first birthday without getting any breast milk, which is what the recommendation is. And now the recommendation, if you've been paying attention to the AAP recommendations, is now for continued breastfeeding for 2 years and beyond. So this is new if you haven't seen that. That just came out about 6 weeks ago. So that's the 1 year mark has now moved to 2 year in alignment with the rest of the world, by the way. So that's good news there. And you can see what is this costing us as a state by having the lower breastfeeding rates, by not being able to sustain that 90% of families would breastfeed as recommended with complementary foods until 2 years of age. It's costing us about $27 million just in healthcare costs. That's not in lost employment, lost wages because they have to take time off work. It's just healthcare. And we also have 22 maternal deaths that are related to suboptimal breastfeeding. And that is due usually to a breast cancer and ovarian cancer that could have been prevented through lactation. And 7 infant deaths. 5 of those would have been prevented from SIDS had breastfeeding happened. We know that breastfeeding is the third strongest link to reducing the risk of SIDS, next to being on their back and in a safe sleep environment. The third most effective then is breastfeeding. So these are some of the consequences that, some of the things that we could save if we increase breastfeeding rates. Next slide. Thanks. So when we look at that nearly 90% of families in Kansas want to breastfeed or choose to breastfeed, we see that that's not the case for all families. And in Kansas, you'll see that our Black families and Native American families have a lower breastfeeding initiation rate than the rest of the state. And I can tell you, and hopefully the next slide will tell you even better, that it's not because they don't value breastfeeding. It's not because they don't want to breastfeed. It's because they don't see breastfeeding as a choice. We often throw this term around that they choose to breastfeed, they choose to breastfeed. But what looks like a choice for me is not the same for my neighbors, because maybe they have to return to work. They don't have any paid time off. So then breastfeeding is simply not a choice for them. Maybe there are other barriers in their life that remove that choice. So I just point this out, that lower breastfeeding rates is not from a lack of desire or lack of knowledge. It's really because there are too many barriers to even make that a choice. We've removed that choice for too many families in our state. The next slide. This is a video and hopefully it's going to work. Is it even there?
If you give me 1 second, I can make it work.
Thank you. I'm going to tell you the background on this video, and if it doesn't come up, we'll send you the link to that. Thank you, Hannah. This is a video that was filmed in Wichita by Joy Marshall Crowley. She's the leader of the Black Breastfeeding Coalition in Wichita. I know, Chris, you know her really well. She's an amazing woman, and not only a leader, but she is very well connected in the Wichita area. And she put out a call on Facebook for families to share their stories about breastfeeding. And she had a videographer, and this video is a result of that call for families to tell their story. And they're all Kansas, all Wichita families. And is it going to work, Hannah? I saw it for a second.
I think maybe it won't.
Oh, that's okay. Unless I was going to say,
I can just pull it from YouTube if you, yeah, we can just give it a
I was going
second.
to say, yeah, do you want to, it's not on YouTube.
Oh, we're going to make this happen, Brenda. So
we could take a spin through our website, Hannah, and I can tell you exactly where to find it. And then everybody is going to get a little tour through our website. How about that?
Okay.
Are you ready? Here we go. We're going to go to ksbreastfeeding.org. And our resources page. And we have a page specifically for African American families and resources.
English.
No.
Cop.
Whatever that was. No. I hit some sort of accessibility button.
Logan has a great suggestion. If you could screen share, then people can see the website. Maybe is that where you're going with this, Logan?
Yep,
hello, Logan, by the way. Logan is also a board member on the KBC.
Logan is always full of fantastic ideas
And suggestions.
Here we go. Okay.
All right. So taking a spin. So if you click on the resources tab,
okay,
then scroll down. By the way, our state of breastfeeding report is there in case you want to download it. Do you see the African American families tab?
Yep, right here.
Yes. So if you are looking for materials specifically that are culturally congruent for African American families, this is the page for you. And the video is Latched Legacy, the very first on that bulleted list. Thank you. Here we go.
We are here to end the stigma that Black women do not breastfeed. There has been generations and generations of Black breastfeeding women. I'm Joy, and I breastfeed.
I'm Antoinette, I breastfeed, and these are my legacies.
I breastfed. These are my legacies.
I breastfed. This is my legacy.
I'm Shanika. I breastfed, and these are my legacies.
My name is Kamisha. I breastfed, and this is my legacy.
These are my legacies.
I breastfed.
I breastfed.
I breastfed. I breastfeed.
I breastfeed.
I breastfed.
I breastfed.
These are my legacies. These are my legacies.
These are my legacies.
Thank you, Hannah. And I still am so excited when I see that video. It's so powerful and moving because those are women in Wichita. These are Kansans in Wichita. And I think it just speaks volumes for the fact that Black women do breastfeed when they have the options and the support that everyone else has. So, All right, we're going to move on to why are we talking to the early childhood system? Sometimes Chris and I get that a bit. It's like breastfeeding, childcare. This is the social ecological model from the Surgeon General's call to action to support breastfeeding. Came out a few years ago, but it's always relevant because what this does is it places different systems in relationship to the influence that they have over the mother. And look at how closely childcare providers and sites are to the mom and baby in terms of influence that they have. And I've been doing this long enough to know that so many of the childcare providers move into friends, right? They're really in that inner circle of friends and almost like family members, especially if they've taken care of more than one of the children for that family. So childcare providers really, I think, are even closer than this diagram portrays. But we know that childcare providers play an integral part to the success of a family's breastfeeding success. How long are they able to breastfeed? So I think that that's absolutely important. Oh, and I see some of the chats about the podcast. That was a lot of fun, by the way. So if you have not checked out that podcast, please do. I think at this point, I'm going to turn it over to Chris Nicholson to walk us through, now that we kind of have set the stage for you, Chris, how can they get involved in this exciting world of breastfeeding in the childcare setting?
All right, thanks, Brenda. I don't know who's managing this, but you can go ahead and move on from the how to get involved. Many of you have probably heard us multiple times talking about our breastfeeding friendly childcare designation. This is go ahead and move to the next slide. As Brenda was going through, we have the breastfeeding friendly communities and the health department. We also have the breastfeeding friendly childcare designation. As you can see, there are 5 criteria that applicants need to meet. When we look at environment, as Brenda mentioned at the very beginning, we want to see an environment that normalizes breastfeeding, that's welcoming breastfeeding families. The policies are created like anything within childcare and beyond. You have to have a policy. So we do have templates that help people through that. We need to see samples of their policy that they include in their family handbook, and also if they have employees, a staff policy, so they can support their staff in continuing to breastfeed. We want to see that they have parent information, family information, as far as resources on a local level, connections to the KBC site. If they're seeking, a breastfeeding consultant or, a lactation specialist, where can they do that? The staff education, mentioned that our friends at Casito come into that they have the online how to support breastfeeding mothers and families training, which is a requirement for anybody that's applying for the designation to complete. They are required to complete that training every 3 years because the staff at KBC and Casito are great at making sure we keep that up to date with the current research. And then mentioning back to the policies for the staff, we want to make sure that they are supportive of their employees, giving them the breaks that are needed. Of course, working with the director or whomever the supervisor is to make sure that they maintain ratios within their classrooms, but again, to be able to be supportive. So next slide. We have the breastfeeding coalitions that we always encourage folks to get involved with. I know when I first attended the first Wichita Area Breastfeeding Coalition, many of them wondered what the heck I was doing there, because I was not a lactation specialist. I did not work with mothers in a hospital setting. But as we've grown, we've been able to, as Brenda said, to kind of understand why we're an important layer for those 90% of Kansas families that want to continue breastfeeding. Once they go back into the workforce, we want to make sure that there is a child care program that welcomes them, that supports them as they continue for whatever length of time they want to. They want to do 6 months, 12 months, up to the 2 years that's being recommended. But we just want to make sure that they have those breastfeeding friendly child care programs. So I know, there's more information about that. There is a KBC childcare section that we are growing in numbers. We meet every other month. I think that's on the next slide and how you can get involved in that. We have folks that work with our Links to Quality, our child care health consultant networks involved in that, CACFP representatives, Casito, KDHE, DCF, Logan's on there from Thrive Allen County. We just continue to grow. If you're not able to attend the bi-monthly meetings, just get on the list, and Brenda's great about sending out information for that. So if you have any questions, reach out to Brenda or myself, and we can get you connected with all the info that's needed. Next slide, I believe.
There's that map of the coalitions. There's also that directory so that you can find your coalitions. And Chris, I know the Wichita Area Coalition really appreciates your involvement, and all of these coalitions would really welcome any of you to help to further this connection. And I think, Chris, from everything that you mentioned, if you were just going to do one thing, I think joining that childcare section is probably one of the easiest and most impactful ways that you can continue learning about how to integrate breastfeeding into your work. Because we look at it under Chris's great leadership. I simply play a supporting role. We're able to have conversations wide ranging from huge cross systems, national level information, all the way to individual child care's implementation of some of those recommendations. So whether you're an individual child care provider wondering how you could make this work, to a state level agency or program administrator wondering how to embed this work into your work, we're able to tackle it on all of those. Okay, and I do see some questions coming in, and I get distracted with those. So help me, Hannah and Megan, that we will circle back, I promise, because Rich, that is a great question, and we will definitely get to that. So I will move on then. Thank you so much, Chris, for talking about how to get involved. I do want to share with you the education opportunities that we have ahead of us that are additional ways that you can further your information about breastfeeding in the childcare setting. So the next slide. Thanks. So the easiest way is to check out our childcare provider page. And I just dropped it in because it does have the podcast link on it. I think of it as a library of resources, and I continue to shelve resources there every time I see a report, a new tool that has come out. Chris and Linda Logan and several others of you as well are great about just sending me an email like, hey, did you see this new handout? And we add to it. So on this page, if you haven't checked it out for a while, please do, because you may find some new resources. And we have had, thanks to funding from Casito, from Child Care Aware of Kansas, translations of many of these materials for parents and for childcare providers. And we also have our course, the Kansas How to Support the Breastfeeding Mother and Family, which is a 2-hour course through Casito that we created, and we provide the instructor for it, and then we host it in partnership with Casito. We've had that translated into Spanish too, and it will have its premiere, I believe, October 20th. Linda, chime in if you know anything different. But we are headed towards October 20th. Awesome. That would be great. And if you could, Linda, drop in a link for that registration. We just think it's really important that that people whose primary language or preference is Spanish, that they have an opportunity to receive the same training. And all the materials were also translated into Spanish as well. And we have found a wonderful person, Carmen Valverde, out in Dodge City, who is a lactation counselor, and she will be providing the training. So in keeping with that content expertise, they will continue to receive high quality education from someone who's very knowledgeable in breastfeeding as well, which is what we've been doing with the English course since 2013. So, all right, next slide. Thank you. We also, in partnership with Child Care Aware of Kansas, will be hosting these technical trainings. Now, you may be asking yourself, well, wait a minute, you just talked about this 2-hour class from Casito. How is this 2-hour thing different? Well, the 2-hour class for Casito is targeted for childcare providers themselves. This training is for the rest of you. And those of you who are supporting childcare providers that want to have some answers at the ready when childcare providers might be asking you questions and you find yourself wondering, like, I'm not really sure about breast milk storage and handling. I don't know about maybe what CACFP says because I'm not in that program. Well, we will distill all of that information for you in this 2-hour training. We're going to talk about the regulations. We're going to talk about the new AAP recommendations for breastfeeding. And I think most importantly, we're going to go through everything that we have learned since 2013 with over 5,000 childcare providers who have taken the course and provided comments. What are some of the themes? What are some of the barriers? What do they leave our course still wondering about or going, this is going to be too difficult for me to do? Or, wow, I had no idea this was true. So we're going to tell you what have we learned from this input from childcare providers so that you'll be better prepared to answer these questions. So kind of a giant FAQ, maybe is another way to, to refer to it. So this is a technical training so that you're better equipped to anticipate and answer questions from childcare providers. So this is, I can tell you the February course is kind of filling up. I think at last we're nearing 50, I think, that have signed up. So if you could wait until the new year, you would have a smaller class size because it will be very interactive. So we encourage you to register for that February course. And thank you to Chris and Childcare Aware of Kansas for supporting this training that we're doing. All right, next slide. The conference. Woo! This is the one that Hannah's all excited for. This is what Hannah came for. All right, the breastfeeding conference. It is a 2-day conference. The first day on October 13th is really for those that provide direct clinical care. And thank you, Linda, for the endorsement of the conference. The first one, if you are really into breastfeeding and you want to be able to help friends and family, and you just have a curiosity about maybe how all this works, please join us on Thursday, the 13th, for a deep dive into clinical lactation. The Friday is what I think of as Friday Fun Day. It is our community engagement day. It is a little less formal, and it is a chance to continue hearing from national speakers that we bring in, but we really showcase our local leaders, our local coalitions, childcare providers. This is when you guys really shine because we start talking about systems that support the families, like I mentioned earlier. So we talk about hospitals. We talk about the role of childcare providers. We celebrate the childcare providers who have achieved the breastfeeding friendly designation that Chris mentioned. So this is really our chance to highlight our local work and all the systems that are supporting it, and to make those really valuable connections. You can meet your local coalitions there. You can meet other childcare providers. And wait for it, the very best part, it's free. Yeah, that's right. It's a free conference. You get to come and have lunch with Chris and Linda and Logan for free, and we'll pay for your lunch. So it is a great way to get to hang out with people who have a shared interest in supporting families in the childcare setting through breastfeeding. So we really encourage you to join us. This picture you're seeing at the bottom of the slide was the last time we were in person. We're going to be in that exact same room. We're going to pack that picture. We're going to have even more people. You can see Linda's there. Chris is in that picture. There are other childcare program providers in there as well. So please join us for a day of community, a day of systems building, and supporting the early child care setting. We will have vendor tables if anybody is interested in highlighting your programs. We do have registration open for exhibitors as well. So you can come in and get more information as well. Oh, there is the agenda. I didn't even think I put that in there. Thank you, Hannah. There you go. So you can see what the day is packed with and who we have speaking. Lydia Boyd, who is shown on the other The other slide is a powerful speaker talking about racial disparities. I know that's something that we all have been talking about, racial disparities and diversity in the workforce. And she is very passionate about increasing diversity in the lactation education field. And this might be something that we could extrapolate and take back to the early childhood field as well. So we're really fortunate to have Lydia with us for day 2 of the conference. And then you can see our celebrations after lunch and our board transitions for the annual meeting is how we always close out the day on Friday. So we welcome you to join us for that part. And you, like I said, you can register for both days or just one of those days. All right, next slide. Questions. All right, this is where you can ask anything you wanted to know about breastfeeding and childcare. And I think, Megan, are you reading the questions from chat or is Hannah? Because I know I saw Mitch had a great question about baby friendly.
Let me ask this. If I pull the chat up, can you all see that?
No,
Perfect. Then I will take care of it.
I can go back through it too, but I'd rather I'd rather focus on the answers.
I have no problem.
And Chris and Linda chime in too.
I forget what people can see when I'm sharing. And so yeah, I haven't done anything embarrassing yet, but
that's all right. And feel free to reach out to me. I always like to say I'm just an email away. Those of you who know me know that I'm on email a lot, probably more than is healthy. So, but I love responding to emails. So yes, please, if you have questions or you think of something else later, you can always reach out by email. So what do we have in the chat, Hannah?
All right, so I've got one question from Kaylee Stillsmith, and she says, I believe Brenda mentioned it, but how was the data collected for this report? Do you mind reminding us which graphic or which report? Was it the one about the cost? The cost and the consequences?
I was going to say I can answer. Go ahead, Kaylee. Which one were you most interested in?
The breastfeeding rates slide and then the race and ethnicity slide.
Yes. So the first one that showed the bar graphs versus the US, that comes from the CDC, and they get it from the National Immunization Survey. That is a 3-year retrospective study, which is a fancy way of saying they call up families of 3-year-olds and they ask them a whole bunch of questions, of which breastfeeding is just a few. And that's how they get that data. So you'll notice in the really tiny fine print on that slide, it said for babies born in 2019. So while we're celebrating these rates that came out on August 1st, we're really looking backwards in time at babies born in 2019. And that's what we have right now. Now, the other slide about race and ethnicity is from the Kansas birth certificate data. So this is real time. This is specifically babies born in I believe it was 2020 was the last birth certificate data that was released. And that is specifically breastfeeding initiation. Birth certificate simply asks, was this child breastfed? It could be one time and they can mark yes. But that is the race and ethnicity data slide that we have specific to Kansas, because the CDC does not provide race and ethnicity by state, only by the nation.
Thank you.
That's a whole other presentation. You want to talk about data? Call me, Kaylee. We'll talk.
Got it. Thank you.
Yes.
So up next we have Rich, and Rich asks, what's Kansas Breastfeeding Coalition's relationship like with Baby Friendly Hospitals designation?
Yes. So we have long been supporting our hospitals in Kansas to improve maternity care. Baby Friendly Hospitals, for those of you not familiar with that title, is a designation for hospitals, it's global, who have implemented 10 maternity care practices. It's a pretty rigorous process. It takes on average 2 years for a hospital to meet all of this, all the requirements. They fly people in, they do a site assessment, chart review, patients interviews. It's really rigorous. And we have supported hospitals to achieve those 10 practices. I'm proud to say, Rich, that we have 10 baby-friendly hospitals in Kansas. We are ranked 8th in the nation in terms of the number of babies in Kansas born in baby-friendly hospitals. Now, you might be asking yourself, and by the way, that number is like 56 or 59% of our babies are born in baby-friendly hospitals. Thanks, Linda. We have a really high percentage, and we're ranked really high because those 10 hospitals are some of our largest birthing facilities. And thanks to the link that Linda dropped in, you can check out the list to see where those 10 hospitals are located. Yes, Rich, one is in your backyard in Lawrence. So yeah, you've got it. We have several in the Kansas City area as well. A lot of that work was supported by funding from KDHE and United Methodist Health Ministry Fund, because there is a lot of staff education involved in this, and they were able to support that as well.
It also looks like, so Rich references a study. He says, I saw a study of baby-friendly hospitals between KCMO and St. Louis that showed significantly less support for Black moms compared to white moms. Who is holding Kansas hospitals accountable?
Yeah, that's a really good question, Rich, about where these hospitals are located. So it's not that the hospitals who are baby friendly are providing different care. It's that the hospitals who achieve baby friendly are often located in more affluent neighborhoods and communities because of the resources that it takes for the facility to achieve this. It's very expensive. It costs $10,000 simply to apply. That is not to educate every single nurse in labor and delivery for 20 hours, every single physician for 3 hours. So it's an expensive proposition, which means that the facilities who achieve the designation are those who have the financial wherewithal to do that. Now in Kansas, we've been able to support some of our smaller rural hospitals to achieve the designation. There was, I think, a really interesting study out of Mississippi who showed they did through their Blue Cross Blue Shield of Mississippi, they are requiring that all hospitals achieve the baby-friendly designation, or they will no longer be receive the same level of reimbursement for labor and delivery through Blue Cross Blue Shield. So, you know, like money talks, right? There's a little bit of a carrot on the end of the stick. And what they found in Mississippi is that they were able to close the racial disparity gaps by having more hospitals in low resource communities achieve the baby-friendly hospital. So the practice is important, but we have to make sure that all hospitals are able to achieve it. So Rich, feel free to come off mute if I didn't answer your question, but I do think that it's an interesting about, does the designation support the racial disparities or contribute to them? I think the answer is no. It's that the hospitals themselves that become baby friendly are not in the communities that are that need to be served. Go ahead, Rich. Oh, I can't hear you.
Yeah. This particular study was a study of how Black women versus white women were served in baby-friendly designated hospitals between St. Louis and Kansas City, Missouri. And it was a qualitative study of interviewing Black women and white women and staff. And so I think it's possible for a hospital to achieve the designation and still treat Black women differently.
Yes.
That's what I meant by accountability. And I mean, it makes sense of what you're saying, that if a hospital serves 95% affluent white women and very few Black women, then that would be what you're saying is would be a good explanation. But I don't know the makeup of the hospitals that were studied there in terms of what populations it were serving.
No, I agree with what you're saying, and I'm familiar with that study. It was done by Uzazi Village and their partners out of Kansas City. So I encourage you to go to the Uzazi Village website and read about that study, which was done through interviews with Black women who had given birth in these facilities. And you're right, it really highlighted the inequitable treatment that it is pervasive. So I think you're exactly right. And how do we hold hospitals accountable to equitable treatment in our healthcare system? I know that our partners, the Kansas Birth Equity Network, are working on racial implicit bias training. That's just a part of the answer. It's a piece of the solution. Residency training is a piece of the solution, but I know that there are the Birth Equity Network in Kansas, led by Dr. Charla Smith, is really addressing this so that it's not just breastfeeding rates, but infant mortality and maternal mortality. This is all combined together. Yep. And Logan had a question.
He does have a question. So Logan, you are a star. I'm just going to say that. I am so thankful that the calls that you're on. It's just, I'm very excited about Logan. Let me put it that way. So Logan says, hi, Brenda. Thank you for your time today. Can you highlight again a few legislative advocacy priorities for KBC and how folks on the call today can learn more and take action in support, which I love. Like, that's great. I think we're all kind of wondering that. So thank you, Logan.
Yeah, that is a great, thanks for teeing that up, Logan. Our advocacy arm is our First 1,000 Days Kansas initiative. And we have a policy agenda, and that is really focused on 3 things. It's about how Medicaid can improve coverage for pregnant and postpartum women. We need to improve access to doula care and lactation support services. So we're working closely with the Medicaid office now that we've extended postpartum coverage from just 2 months to 12 months. That was a great win last year that came about in the summer. Now we want to make sure that that coverage is really providing the services that families need in that first 1,000 days. And that's really focused on doula coverage and lactation support provider access. The other part we're focused on is the Pregnant Workers Fairness Act, that pregnant workers in the workplace have access to accommodations that they need, including breastfeeding families when they return. Thank you, Linda, for grabbing that. So the Pregnant Workers Fairness Act, and of course, I think of it as like the holy grail of a policy, paid family leave, right? Don't we all need access to paid family leave? That would solve so many issues, from infant mortality, breastfeeding rates, even our childcare crisis and access to infant care could be solved. And I think about, I talked to Security Benefit. They have the on-site childcare providing in Topeka, Security Benefit. I talked to their director several years ago, and she told me a story of how Security Benefit extended their paid family leave from 6 weeks to 4 months. And guess what they saw on the childcare side of it? She saw families returning to work and infants coming to care at 4 months of age that were breastfeeding was well established. The parents were a bit more rested. They were less stressed. And the transition to childcare for a 4-month-old, she said, was just amazingly different and better than for a 6-week-old. And to me, that testimonial has just always stuck with me, because we think about what it's like from the parent side and the infant side, but we often don't think about what is it like from the childcare provider side. That it just makes childcare easier when you're caring for a 4-month-old who has had 4 months with a parent to get off to a good start. So I see something came up in the chat. I'm distracted, Hannah. What happened?
No, you're good. So Bethany Samuel just says that Oracle was Cerner offers 14 weeks of parental leave, which is incredible.
Wonderful. That is great. That is great. And I think this is something we can all get behind, because for the childcare system, it really relieves that pressure for infant care from those early days, sometimes up to even 4 to 6 months, can really take the pressure off the childcare system. So this is a policy. When Logan was asking about advocacy, we really are going to be looking to our friends here in the early childhood field to support that paid family leave. It's being considered on the national level. And if that doesn't happen, we may have to roll up our sleeves here in Kansas and make it happen for Kansans. So stay tuned.
I think that is all we have for questions. Chris, thank you so much.
Yes.
Thank you so much for supporting. Thank you for all that you do and all of the circles that you're in. But specifically, thank you for your information about KBC, Chris.
Yes. Yes, we have a roundtable coming up on October 7th, specifically about paid family leave. And we have some national experts lined up. So that link that was just dropped in there, feel free to check it out. And thank you, Linda, for your support. This all started, I think, over a lunch in 2013 when our goal was to educate 60 childcare providers about breastfeeding. Here we are.
Well, we always appreciate having you on. And like I said, I like to keep you just kind of on a cycle, right? Because you always
Thank
have
you,
something
Hannah.
new, and it's very informative. So we appreciate you coming. And if anybody has any
Thank you.
follow-up questions that you didn't get to, you can send them to myself. You can send them to Megan, and we will get them to Brenda. Just as a reminder, as we're coming up at the top of the hour. So our next early childhood recommendations panel meeting, which is on our YouTube channel, is October 21st. That's 9 to 11:30. It probably won't be that long. And then our next biweekly webinar is going to be October 5th. So 2 Wednesdays from today. I'm really excited because we have one more opportunity to highlight some relevant ways to connect during Hispanic Heritage Month, which we are still in. That's September 15th to October 15th. So that is noon to 1 p.m. And then the full Children's Cabinet and Early Childhood Group meeting, October 7th. So we have the Children's Cabinet meeting in the morning, followed by Early Childhood, formerly stakeholders, in the afternoon. If you've not registered for those, you can register in the link provided. And as always, if you are somebody who is wanting to be a Brenda for us and come and present, talk about your agency, talk about an initiative maybe that you and your program are doing, something that's working well. We always love to have presenters. We need presenters. So reach out to me and I'll get you on our schedule. And that is all that we have for you today. Thank you to Brenda. Thank you to Logan, Linda, and Chris. We appreciate your time and we will see you all in 2 weeks.